And if you really understand their addiction, we have to ask, well, what gave you so much emotional pain? And how come you didn't have the internal resources? This is not a judgment, it's simply an inquiry. How come you lacked at some point the internal resources to deal with that pain in a more creative, forward-looking way that would help you resolve the pain rather than to perpetuate it? So really what it was is that the addiction came along to help you solve a problem you had no other solutions for at the time. And that's the case for all addictions. So why do people use? Why do people engage in addictions? Because they have deep emotional problems they don't have the means to resolve on their own. That's why they use. The average medical student, until very recently, has never even heard the word trauma in their education. It doesn't show up. We don't talk about it. We don't talk about its impact on the brain, on the personality, on the emotional life of people, on its impact on people's physical health. It's not a word that we mention. We're traumaphobic. As a fellow doctor said to me, the medical profession is traumaphobic. Psychiatrists these days are trained mostly in this biological model of psychiatry where everything comes down to a biological brain disease. Here, let's give you a pill. The last thing most psychiatrists know how to talk about is actually emotional pain or its origins in human experience. You'd think they know how to do that, but they don't. They're not trained in it. It's not part of the predominant medical ideology.